Good morning, everyone. My name is Dr. Russell Barron, Board Chair of the Canadian Chiropractic Association. I want to begin today's announcement by acknowledging that we gather here today on the traditional, unceded territory of the Algonquin and Anishinaabe Nation, including the Huron-Wendat, Haudenosaunee, and Anishinaabe. The Algonquin people have lived on this land since time immemorial, and we pay respect to their deep connection with this territory, a connection that is both ancient and ever-evolving. We are grateful for the opportunity to work, live, and learn on this territory in mutual respect and gratitude. Our country is currently navigating a complex and challenging climate in healthcare. Our system is under immense strain, grappling with a health human resource crisis that impacts every facet of patient care across the country. We're faced with significant shortages in emergency room capacity. Our emergency and family doctors are experiencing critical backlogs with wait times ranging from 1 hour to as long as 9 hours. This is jeopardizing timely access to treatment and overall health outcomes for Canadians. According to the World Health Organization, musculoskeletal conditions are the leading cause of disability around the globe. To put this into a national context, more than 11 million Canadians suffer from musculoskeletal conditions every year, and over the next decade, this is projected to grow to an alarming 15 million. Chronic pain conditions alone are the third leading cause for emergency room visits and account for 27% of physician visits, and they are a key driver of the initial prescription of opioids. We cannot ignore the alarming number of opioid-related overdoses that are increasing every day. Musculoskeletal conditions not only have a negative effect on the delivery of healthcare in our country, but also impact our country's workforce and productivity as well. To put this into a dollar figure, it is estimated that the economic cost of musculoskeletal conditions is $22 billion annually. In this context, it is crucial to acknowledge the diverse contributions of all healthcare providers, including doctors of chiropractic. Chiropractors are integral to the multidisciplinary approach needed to manage chronic pain, enhance mobility, and promote overall wellness. By providing care that often reduces reliance on pharmaceuticals and alleviates pressure on our overburdened hospitals, we can contribute meaningfully to a healthier Canada. Today, I'm joined by the Canadian Chiropractic Association's Chief Executive Officer, Dr. Ayla Azad, and students of chiropractic, Louisa, Ina, and a very recent graduate, Camille.
Thank you, Dr. Barron. Ina, Camille, and Louisa are 3 out of the approximately 220 chiropractic students that graduate each year from across the country. These students undergo 8 years of schooling and have 4,500 hours of clinical education under their belt. I know how rigorous of a program it is because I taught at the chiropractic program in Toronto. These are the future leaders of our profession. However, they find themselves at a critical juncture as the recent eligibility expansion of the Canada Student Loan Forgiveness Program out of Budget 2024 did not include doctors of chiropractic. This program is designed to support healthcare professionals who dedicate their careers to serving Canadians in underserved communities, a mission that aligns perfectly with the values of our profession. But by excluding doctors of chiropractic, we are removing the ability for people in rural and remote communities to access care that they desperately need. I would now like to invite Ina, Camille, and Louisa to share a few words about their experience as students of chiropractic. Ina.
Driving hours to see a practitioner through the snow or unsafe conditions, waiting hours in an emergency room, or having to take time away from work and family to access healthcare out of their community and sometimes out of province is the reality for many Canadians living in rural and remote communities. The exclusion of chiropractors from this program will not only impact current chiropractic students, but will also have a ripple effect on the communities that we serve.
20% of Canadians live in rural communities but are only served by 8% of the physicians. Many of my fellow graduates have chosen to begin their careers in urban centers, where they can manage their student debt more easily, thus leaving rural, underserved areas limited and without any evidence-based, non-invasive, and non-pharmaceutical options to managing chronic pain. Notre profession prône une approche globale de la santé qui reconnaît l'importance de tous les professionnels du système de santé. L'inclusion de ce programme permettrait non seulement d'affirmer le rôle des chiropraticiens, mais aussi d'encourager les nouveaux diplômés à servir dans les communautés qui en ont le plus besoin.
Students of chiropractic deserve to be part of this program. We are choosing this profession because we want to keep Canadians living healthy, active, and pain-free lives. We are training to be primary healthcare providers who can then support the healthcare strain that is affecting our country. By not including chiropractors in this expansion, we risk perpetuating the very shortages we are trying to resolve. Chiropractors are vital in addressing the musculoskeletal issues that affect millions of Canadians. Individuals and families living in rural and remote communities are disproportionately impacted by musculoskeletal conditions compared to those living in urban centers and deserve to have access to non-pharmacological treatment.
Thank you, Ina, Camille, and Louisa. Throughout my career as a chiropractor in a multidisciplinary clinic, a chiropractic teacher, and a mentor to many of the dedicated chiropractors serving patients across our country, I've had countless conversations with emerging practitioners. Time and again, I hear the same concern: the challenge of balancing the desire to provide quality patient care while struggling to earn a sustainable living. This is a pressing issue that affects not just our profession, but the health and well-being of communities nationwide. We must also acknowledge the critical importance of early access to care, especially in rural areas. We are capable of diagnosing issues, providing treatment options, and referring to other practitioners if appropriate. We can keep patients out of the emergency room, provide care that is both cost-effective and delivers high-quality results, and redirect the limited resources that are available to where they are most needed. Today, we urge the government to reconsider the oversight of not including doctors of chiropractic in the Canada Student Loan Forgiveness Program and encourage them to work with us to ensure that doctors of chiropractic can access the support they need to continue serving Canadians effectively. We must create pathways that attract and retain healthcare professionals, such as doctors of chiropractic, to build a robust and responsive healthcare system. We are requesting the Government of Canada amend Bill C-69, the Budget Implementation Act 2024, by adding chiropractors to the Canada Student Loans Act. This aligns with the priorities of both the CCA and government, as well as will encourage new graduates to invest and open practices in these underserved communities. Together, we can make strides toward a more equitable and comprehensive healthcare system in Canada. Let us work collaboratively to ensure that no patient is left behind and has access to the care that they need. Thank you for your time, and I look forward to your questions.
We will now take questions on Zoom. Please use the raise hand function. As usual, one question, one follow-up. Nous allons maintenant prendre les questions sur Zoom. S'il vous plaît, utilisez la fonction main levée, comme à l'habitude. Une question et une question de suivi. Is there something you'd like to add to your statement?
No, just that we are very happy to start the conversations and have a collaborative conversation in how we can amend this and get doctors of chiropractic included. The burden of musculoskeletal conditions is so great across this country. We need all hands on deck, especially in the rural underserved communities, and doctors of chiropractic are here to help. Thank you.
Thank you. This concludes the press conference. Merci.
Merci.